And so we have begun. So we're basically gonna stick with this starting. This is the next unit. None of this is on the exam on Monday. This is our unit 2, which typically is going to involve this chapter, control of growth, talk about viruses, talk about microbial genetics, and that pretty much is that next. And there's certainly a lot of material, even though I don't do as much on the genetics as I used to, which probably will make you happy. This is a really, to me, this is the first of the really clinically oriented chapters that we do. And again, just the very name of when we switched to this book some years ago, and I don't mind it. I've spoken with it many, many times. Is it's supposed to be a clinical approach, and I think they do a good job on that. And really, this is applications not just for people like many of you going into a medical or clinical field, but for at home, for how to deal with things, how to basically disinfect things or use different kinds of antiseptics, make a determination on what's best available with given the circumstances you're in. There's a whole lot of information that's practical that might surprise you. So that maybe is the jumping off point for this. And I mean, they take these. I like the way when Nestor does it right away. I mean, first we learn how they grow, then we learn how to get rid of them. But they have others that they do with this particular textbook, and that's fine. I just jump around. So really, we're going to talk a little. We have some definitions to go over. We have to look at really why you have to choose different things for different approaches to removing potentially problematic microbes from our environment. Understanding the terminology is very, very important. This becomes a microbicidal v microbistatic. It's a very important thing, particularly when we get to antibiotics, which is actually the next chapter. But we do this in a different sequence. I start my real clinical part in the second half of the course, and so effectively that's when we start attacking how diseases spread, the nuances of them, and then look at ways to treat them very specifically, like antibiotics, antivirals, antifungals. And the terms bactericidal and bacteriostatic are extraordinarily important, and indeed maybe the single most important part other than allergies as to what we pick and choose for antibiotics. And the targets, I don't deal with the targets here. That's more relevant to antibiotics. As I framed it to the other group this morning earlier, most of these work by denaturing proteins. We use a lot of heat. And most of the things that sterilize, it's all about denaturing the proteins. And so I really don't focus too much on that. I mean, the only oddball out of that, and it's not particularly strong, but we use it constantly, is alcohol. And alcohol dissolves membranes fairly effectively. So that and alcohol's got a lot of good and a lot of bad, and they're all the same thing because it evaporates quickly, as you will find out. And so we really divide this into, pardon me, after the initial discussion, we're going to first focus on physical methods of control and then go to chemical methods of control. So antibiotics, antivirals, etc. That's a whole other chapter that we spend a very, very long time on. And many of you are taking intro nursing over there on the ground floor next door. Do you see those whiteboards? Have you been paying attention to all the stuff that's on there? I walk now by there every morning. If you think this is complicated, see what's on those whiteboards. Okay, I know. Wonderful saying from a great movie called Godfather 2. This is the business you have chosen. All right. Only Strasbourg fans. Okay. So we're going to look at all of these different terms, whether it's sterilization, disinfection, sort of tell you really what decontamination and sanitization is. Antisepsis, there's nothing in the English language for degermination. In my 50 years of dealing with this stuff, I've yet to hear somebody tell me that term other than a textbook. But I digress. Sterilization, the destruction of all viable microorganisms, including viruses. Understand that prions are not in that discussion as yet. We don't have scientific evidence what reliably gets rid of prions. Okay, I'd say kill, but they're not living. It's just a misfolded protein. A lot of people think it's just a higher temperature and a little more time than you would use in an autoclave, which is basically a pressure cooker, and just changing the numbers a little bit. That's been around for, but no one's ever proven it. So prions, as far as we know, could be on anything that we consider sterile. When we get to prions, you're going to see we're not quite sure how they get to where they're going, and it's not something I would not worry about the next time you open up a Band-Aid and put, oh my God, there could be prions steaming on my skin. Typically, you have, as far as you know, we have to ingest this in order for it to affect us more than anything else, or directly into the bloodstream. I don't think it's going to happen in that manner with what prions are. Ugh. Nevertheless, so sterilization, and the whole watchword is, you'll see it come down, it's about addressing everything and destroying everything, including bacterial endospores. As far as we know, scientifically, they are the most difficult ones to kill, and we have to address everything with regard to that. So the term sterile is only used, and this is really, people misuse terminology, only in the strictest sense to refer to materials that have been subjected to the process of sterilization. Again, there's no slightly sterile. My old joke is, it's like, there's nothing like, it's not like being a little bit pregnant. You get the idea. Either it is or it is not. Humor me. I didn't use this intentionally because I like your class better. I didn't use it in the last class, and I would have appreciated a smile. Yeah, thanks, Maddie. Where were you Friday? The other Maddie behind you. Where were you Friday? Yeah, no, yes, Friday. You took the day off. Admit it. Yeah, I got you. Sorry, there's too many people with the same name. I have an onslaught of Avas, both of whom you know. The names, if you did not know, as we reflect back, as you get older, you reflect back on the names continually change. All the common names that were there in my generation, nobody. So again, reserved for inanimate objects. You cannot sterilize skin. Again, if somebody says go sterilize the skin and it's a nursing instructor, I'm on it. Okay, from a test perspective, I'd be very watchful of that. Yes, particularly on a licensure exam. I mean, when you can't do it by definition, sterilization is for inanimate objects only. Period. Okay, if you try to sterilize, you can't submit your skin to large doses of radiation and expect it not to be destroyed or severely damaged. And so you're going to see different things, and I'll explain to you in a bit about that. I get all sorts of agitated about that. I want you to, if you at least do it for me, and then you adapt to what other instructors are telling you. I want to give you the classic knowledge about it. And so you're going to, any agent that we use that can sterilize by definition is a sterilant. The other term you're going to see, particularly when you get to chemical agents and some physical agents, is the term sporicide. That means a bacterial endospore destroying agent. That by definition is a sterilant. It's a sterilant, it has to be a sporicide and vice versa. Disinfection is also only for inanimate objects, period. Okay? And its ability to destroy vegetative pathogens, but not by implication bacterial endospores. It doesn't get them all. Removes harmful products and microorganisms, toxins. Effectively, when you're doing a load of dishes in a dishwasher, you are disinfecting them. And indeed, you'll see shortly that you are pasteurizing as a form of disinfection. Okay? When you cook something in boiling water, you are to some extent disinfecting it. You are by no means sterilizing it. Can some things be sterilized by boiling? You bet. But if you want to take it into the global sense, it cannot be utilized for everything, and therefore it is not a form of sterilization. It's not normally, it's used on inanimate objects. If you had the agents you use, you would have to use in such harmful levels or in such physical aspects, in such harmful amounts and or temperatures, that it would be incompatible. You would damage the tissue. I would not have put iodine in here. What they comment here about, I don't even know if you guys can share with me what they do in the hospital when you get to clinical. They still put thermometers and iodine. We never did that. They still use plastic sleeves and stuff on those things? I don't know. Because like a lot of people, we have one at home, and my wife and I, our germs are compatible, at least as far as we know. So again, and then lastly, when we're talking about antisepsis, we're providing antisepsis, we're talking about living tissue. Okay, involved. It's not only the skin, but it does involve scrubbing or washing the skin, or immersing something like that in chemicals or applying chemicals to it. Is it I'll agree to a limited extent. It's a form of decontaminating. Okay, and there's a lot of things, and I spend a fair amount of time, particularly on surgical hand scrubs. Again, these are, I agree with this in the sense that they're cleansing techniques to mechanically remove microorganisms as well as others to reduce contamination to safe levels. The issue is, who says safe? And safety is defined by a governing body. Whatever it could be, federal, state, local, the facility that you work at will have. So, I mean, again, don't make a big deal of it, because I do. They go decontaminate this or go sanitize this. I think when you go to like a motel and they got the thing on the toilet seat, it says sanitize, that's what I think about sanitize. Did you see him do that? I didn't. It's just me. But the reality is that those are standards. And I'm, many of you, particularly for most of you who are still at entry level, wait till you have it. And I told the other group, the day you're going to dread, and you'll get used, is when the surveyors in or inspectors are in. The state comes in. Joint Commission, which is the governing body of all hospitals, JCHO, comes in. And they can come in unannounced and look at anything at any time. Period. They can look at any charge, any file, and you got to know where all that stuff is. And have them, and they all come in at 2:00 in the morning, in the middle of the night, unannounced. Most of the time, you get a heads up. If you work in a nursing home or a long-term care facility, watch out. Because all you need is some unhappy child, grandchild of somebody who didn't like the fact you took care of grandma or grandpa, and they complained they weren't being nice to me and they hurt me, and they're going to put a call into the state. And the next thing, in the middle of the night, you have surveyors coming in, and everybody, that's the worst day of your life. You're under scrutiny at all times. You have to get used to it. The whole standing over your shoulder thing, this is worse. So understand that this is these levels, and you have to say, yes, you set this out here, we're complying with what you have to do, just like the requirement. You're taking a test here. Here's the syllabus. Here's the study guide. The same kind of a thing. You can't get away from it. It's everywhere. And remember, I practiced and operated 90% of the time in my own office. I still had people, certifying bodies, coming in periodically, checking my x-ray unit for me to be able to be covered by, let's say, UPMC insurance. I had to come in, certify the office and all that stuff. It's a whole lot of stuff you got to know. This is a great table. I mentioned it before. Well, what it points out to you clearly, heat is an immense player, and the most effective heat is moist heat, steam, because it penetrates. You all know what steam is. It's water molecules moving around super fast. You incinerate all the time. In the lab, you're flaming the loop. That's incinerating, superheating, and destroying. You could use an oven. The problem with using an oven as opposed to a pressure cooker, which is what an autoclave is you're limited by space. You'd have to, if you have an oven, we have a double oven at home, you can put a bunch of sheet pans in, but everything has to be single filed. If they touch, the heat does not get through. Steam gets through. Steam under pressure, 15 pounds per square inch, gets in between all those, because they're not adherent to one another. There's always space, molecular space. That's the beauty of steam. And it's very inexpensive. It's not hard to boil water. It's not hard to pressure cook something. If you have, like I said, buy an Instant Pot, you can do it at home. Basically, the pressure cook, the most autoclaves are nothing a lot more than that, without a little more gizmos and things like that to help you interpret or read. Like the one that they're working with, that all of your laboratory supplies are being sterilized. And whether it's liquids or solids, they're being sterilized in an autoclave room, which is the door as you walk into the micro lab directly to the left. Elaborate, we need it. Anybody with a functioning micro type lab or does micro research needs it. That's there. Radiation. Ultraviolet does not sterilize. Ultraviolet, as you will see, is useful for keeping things from growing, but not useful for destroying something, where gamma rays or X-rays are. And that's the other thing that people, oh my God, it's X-ray sterilized or gamma ray sterilized. Am I going to get radiation from it? You're not. I asked the other class, I was surprised. Have you either seen or used new blades on your dissecting tools, on the dissecting scalpels and things like that? When you've dissected? If you look in the drawers there are disposable blades. They're used in surgery all the time. If you read it, I should bring one in. I was just up in the lab. I forgot. It says sterilized by gamma rays. I've opened thousands of them, literally thousands. Despite what you think, the radiation has not affected me. I was crazy like this before. Thank you. I'm so glad you're back. Somebody appreciates my humor. A little bit. Not so much. Not at all. Moreover, the next time you open up a Band-Aid, the next time you take one of those neat little sterile Q-tips that you use in the lab, next time you open up one of the little syringe or needle packages, guess what? They were all sterilized with, you guessed it, poison gas. Yet we have all survived this. It dissipates very, very quickly and is sucked out of the room and cleared with air, and it's sealed if it's inside the package. That's what we utilize extensively for things that you can't use moist heat or other means to sterilize or radiation. Okay, and indeed, you're going to see there are some liquids we can use. The thing is, the other one here, filtration, if you're using certain liquids and you know exactly their contents, theoretically you can filter out the microorganisms. It's done with some consumables, and I think it's more of what we call commercial sterilization, which is food quality. It just depends. And what was the other one? Lastly, to me, mechanical removal is much more about hand washing is less, despite what textbooks will tell you, less about what you're using, despite the circumstance, or given the circumstances typically. If you're just washing your hands normally, hand washing works whether you have no soap, whether you have bar soap, antibacterial soap, or even special soap. It's very hard. I do that experiment in micro lab. I've done it for, I don't teach labs very frequently, but maybe 20 years. And there's really not a substantial differences, even with the soaps that you use to wash your hands for surgery. Okay. And you're not sterilizing your hands again. It's living tissue. You're making the tips of your fingers, the dirtiest part of your body, okay, sufficiently clean to grab what's called the non-sterile end of a glove. The glove is sterilized, poison gas, inside and out, and you reach into the glove to get your fingertips down there to start. So that becomes, we call it sterile to sterile and non-sterile to non-sterile. That's what this is, and it's more appropriate. It's not sterile technique, though again, it'll be referred to that depending on the instructor. It is aseptic technique. Things don't stay sterile. If I open a sterile pack, it's on the table, in an operating room, within the hour, if it's not used then, it is no longer sterile. It's been sitting out that long. Go get me another one. Sometimes the surgeries go a long time. Fortunately, as you will find out, I had 2 8-hour ones. Not fun. I know, but I'm still here. It just bothers me. Everybody keeps opening doors for me these days. I may look old, but I'm not that old. It must be the look I have. Primary targets of... As you get older, you'll look in the mirror, you'll still see the person you were when you were a kid. It's the eye of the beholder. So, lots of them. Okay, there's a lot of different forms, and I'll show you the ones, and it's based on resistance. Bacterial endospores, by far and away, not traditionally, they are. And again, destruction of endospores, we said enough endospores. Prions, again, we surely denature them, but they're already misfolded. So that's, and they have been studied, and typically we think it's only from ingestion more than anything else when we talk about prions, and there's been done a lot of studies. The definition, I'll show it to you when we get to that unit. But for our purposes, this is it. Now, mycobacteria, leprosy, and tuberculosis. That thick capsule, that waxy capsule, that's where it gets its name, mycolic acid. Very hard to deal with. Okay? And then Staphylococcus, as common as you want. Pseudomonas, believe me, you're going to work with in the lab. It's that common. It's on your clothes. It's not by any means a normal, because it's a pathogenic organism. So now we call it normal flora or a normal microbe on your skin. But most of us have it. It's everywhere. It gets into hospitals because the people who visit, and for years they had to stop, particularly with plants and things like that. They began to restrict in certain areas. Oh, we'll bring in plants, we'll send flowers. Well, you got to be careful with regard to that. So there's a lot of restrictions in certain places, depending on the diagnoses, because it's everywhere. And other things, we talked a little bit about protozoan cysts. We'll talk about that. Harder to get rid of than that active feeding stage. And notice we get down to gram negatives and gram positives, non-enveloped and enveloped viruses and fungi, relatively easy to take care of. You'll note that enveloped viruses are the easiest ones. That alcohol swab that you cleanse skin or you cleanse the top of a multi-dose vial with doesn't do a whole lot. That alcohol that we have in hand sanitizer doesn't do a lot, but enveloped viruses are the easiest things to get rid of. If nothing else, and understand the viruses that affect us most commonly this time of year, influenza, RSV, we'll get to all of these, and COVID. They're all enveloped viruses. There was a tremendous amount of misinformation about COVID. They thought, they had COVID and they were in my classroom. Oh my God, don't ever go in again. Gee, contaminated forever. Nothing could be further than true. Close proximity, and we don't get preachy. Yes, we'll get to COVID soon enough. Moving on. Moist heat. We only have to increase the temperature by a factor of 50%. And it's so easy, it's so obtainable. X-ray, we only have to go 4 times more. What would be a normal to destroy what they call vegetative forms, the easy to destroy ones, to get to the endospore. The poison gas, although it has a lot of problems, which we'll get to, but not today, that's in chemicals. That's either going to be Wednesday, but most likely Friday. Again, less than twice as much. But look at this. If you did not know it, sporicidal liquids, which we will also get to, we call them cold liquid sterilization. A lot of offices did that. I did that in my office for more than 20 years. You had to sterilize things overnight. That 3 hours is at best a generous thought. You can cleanse them off pretty quickly. But if you're talking about sterilizing them, it takes a long time. So I didn't have to, because my instruments, if I had to continually sterilize them, things with hinges and moving parts, that's a problem. Moving on. So again, this is the nomenclature that you'll get used to. The key one is here, sporicide. Capable of destroying bacterial endospores by definition. It can sterilize. Many things we use for different, if it's a bactericide, a fungicide, a viruside, most of those common agents that we use kind of fit all into those. The term that we use is very generic. Germicide and microbicide, very, very generic. So you really need to specify things like that. So for our purposes, it's either a sporicide or it's not. Again, we're going to get into bactericide versus bacteriostatic, very importantly in antibiotics. And so when something is septic, microorganisms are in it. And so asepsis technique that we use. to prevent the entry of infectious agents into otherwise sterile tissue, therefore preventing infection. And it's really what we're doing, aseptic technique. Again, somebody calls it sterile technique, fine. Don't raise a ruckus. If you do it accidentally, just blame me. He told us to say that. They come up and start yelling at me, I'll tell you just what I do. Hey, elder abuse, don't do that. Oh, my wife nearly killed me. Didn't I tell you this last year? We were at Costco and our vehicle has one of those, the lid closes, and she's closing it, and it whacks me in the head, and it's like, oh. And she goes, I'm sorry. I go, elder abuse in the parking lot, and people started to laugh. I got one of those in a big way. Moving on. And antiseptics directly applied to the skin. You can even do it conceivably before. So here, it directly applied to exposed surfaces, wounds, and there's some guidelines with wounds and things getting inside. Surgical incisions, again, some guidelines, and we use the antiseptics all the time. Most of the time, you're going to be sick and tired of hearing me talk about betadine. Betadine, for whatever reason, a lot of textbooks classify that as a disinfectant. It is not. It is much far superior, and you'll see how we have dealt with it. Betadine and something called chlorhexidine, which are the agents that we use for surgical scrubbing. You need to become familiar with those a lot because they're really the true germicidal soaps. The germicidal soaps are the antimicrobial soap, that antibacterial soap that you have in that pump bottle, like we all do at home. Okay, the agent in there is not terribly strong because they can't give it to you if it's overly strong. And the ones that were stronger over time, they've typically been taken off the market. So you're not using anything that's particular, and we'll get into all of those as well. And again, static means you stop the growth cycle, but you don't destroy it. And by implication, once it's no longer being used, it can grow again and flourish. Okay, and even a acidal agent does not necessarily result in sterilization. It's all about usage. Like I said, you're going to see those aldehydes are sterilants, but for 10 minutes, no. For 10 hours, yes. Not a big deal. I used to ask about a question. Something we misplaced. My wife found it. Yes. I didn't say anything bad about you today. She could be listening. She may put one of those things on my phone. Critical devices. For our purposes, there are two. Critical has to be sterilized. Anything that potential sterile tissue is defined, we'll start with non-sterile tissue. Your skin, the linings of your gut, respiratory, genitourinary areas, period. They're covered in, you did this last year, they're covered in lining tissues. All those stratified squamous and simple columnar epithelia, effectively, they are not sterile tissue by definition. Your colon is filled with bacteria. Your esophagus has bacteria. Lord knows your respiratory tract does. It harbors almost as much as any area that causes us problems. Your skin is covered in. So for skin, we call it non-critical. Blood pressure cuff. Part of a stethoscope. That's all. Nothing special that you have to do with it. Really, wipe it off. Most people, people think of it like that. Critical, sterile tissue inside. For years, we had semi-critical, and they used high-level disinfectants, and there's a whole categorization. The best example of this are endoscopic tools. Okay, most people, if you hear about it, like an athlete with a joint being scoped, you're sticking a fiber optic tube, let's say in the knee, see if they have ruptured an ACL. Okay, just to be sure, maybe they did an MRI, most likely. The tip of that is sterile. It's passed in, the other half is passed out of the field, given to somebody who hooks it into the machine that will take the pictures you'll have a video display. That's how it works. Endoscopes, inside, endo means here, inside. So they either go into your esophagus, stomach, and small intestine, or the colonoscopes take a more direct approach, if you know what I mean. Okay? And basically, you can see your colon with regard to that. They did not have to be sterilized. So what they had was a system where the manufacturer would say, okay, so they usually have a typical GI lab would have 2 sets. They'd be using one. And say they endoscope somebody to look inside their stomach for an ulcer, like they did with me many, many times. And then when that one was done, they put it in this system, this disinfecting system, and they get somebody else. They pull the sterile one, the one that was now disinfected out, and use that. And it actually was around here. It was about 20 years ago. A nursing student I had at CCAC South worked in the Jefferson Hospital lab, in the GI lab, and she was taking her. She was just a tech. I hate to put it that way. She was a tech, and she had the goods on the store. It wasn't at that hospital. You have to follow the manufacturer's instructions. The scope was fine, but scopes have tiny ports that have to be sterilized specifically, and whoever did it did not do it properly, or they went on the cheap and didn't use the manufacturer's system. Long story short, they were treated. It was an HIV positive patient. I can only imagine the legal ramifications of this. Nowadays, most of these come with, and I think there's a picture in this PowerPoint sequence that we're going to get to. It's like you buy it. The company makes money. It's like a suitcase system, and you put it. You clean it out. You put it in the suitcase. They use hydrogen peroxide, which can sterilize at what we call vapor phase. And you have to, if you do it in that, it will sterilize everything. So, I mean, I don't think these are that much anymore. My last scope was a year ago. I had a follow-up endoscopy a year ago. It's fine. Okay, so yeah, I get them with some degree of frequency. I keep forgetting to ask at that point, but I'm just trying to give you an idea. So I don't really ask a question about that. I want you to be aware. For me, for our purposes, they're critical and non-critical and critical to me. I mean, if they want to they'll let you know if you have to know that. There's no one-fits-all approach to sterilization. It depends. You can't heat things because they are not heat stable. You can't use liquids because they may corrode. Not all things are amenable to gas or radiation. So you have to pick the right manner. Most of you don't have to think about cost, but understand, we did all our sterilization other than buying stuff that you typically, like gowns and gloves like that, you don't sterilize because they had to be done with gas. So my ex was an RN, BSN, head nurse of an emergency. She trained my staff on how to do that and this is stuff you're probably going to have to do. Or you're going to be running a clinical facility on your own and charging, knowing the level that some of you are going to. That's why this is important. You may not be doing it every day, but you may be required to make sure it's done properly and to train properly. And all of this is part, and there's a lot of stuff that goes on. Nowadays, we have to, since 1994, contaminated materials, those red bags. I had to start doing that at my law. All of this changed when the law changed about 1994. And then all of a sudden, even a facility like mine, a single doctor office, we had to have all the things necessary to do this. It's something. There's a lot that's associated. They're dead. Good enough for me. It takes time. That's why you'll see variations in times to accomplish this. How they determine the time for sterilization. They basically took an immense, something that was so contaminated, you could never duplicate it realistically, and see how long it took to sterilize it by a variety of methods. And they came up with the times. It's sort of the inverse of that growth curve. It's like they die logarithmically and they grow logarithmically. So they looked in different units. And so basically, the number is there where it's only an unimaginable amount of contamination. will be there. So I don't even go over that anymore. I used to, but the more there are, the longer it takes. Okay, the nature is improv. Obviously, temperature and pH of the environment play a role. You're going to see this as we get on with it. The critical thing to understand, I am coming to right here. Presence of solvents, organic matter, anything on there compromises your ability. Have any of you seen surgical instruments after an operation? They are disgusting. There's yuck all over them, and yuck, I mean, all kinds of yuck in any definition. Here's what we did in my office. So my first wife came in, and she goes, okay, you're going to put on a gown, you're going to put on gloves, you're going to have a mask, you have the protectors, cap, just without having to go through all the hand washing, but gloves were enough. And we take all those instruments, and they gather them up with this, and we have a big sink area. You put them in, special disinfecting agent, just to loosen it the way you would take dishes or pots when you did a lot of cooking and stuff, and you'd soak them in that. And then after it was soaked from that, the next one, you rinse that off, the next one, you clean off scrupulously every bit of that organic material. And then finally, when it's ready, we could get it ready for pack and re-sterilize. I'm going to show you that stuff, which we won't get to today. Does this happen in your house? My wife will go to the dishwasher and go, is this clean or dirty? Because we scrupulously do that with the dishes. Because if you pull something out, a spoon, a knife, a plate that's got yuck on it, what are you going to do? Oh, I'm not using that. Same deal. Because when you subject it to heat, typically it coagulates those proteins, adheres them, and the heat can't get underneath it. So conceivably, you could have something bad for you. Your dishwasher is pasteurizing your dishes. So it's not going to get through that stuff. So there's lots of different things, and we'll go into it, that are there. We don't worry about the targets from our purposes. They're going to have a chart after this. It's not that critical. Okay, most of them, it's about proteins. Like I said, alcohol would probably be the exception. I don't think I have a question on this on the next exam. I'll review it, of course, to let you know. We're along. Your first concern is the exam on Monday. So they have like little listings of this, but most of them denature proteins. This is much more significant with antibiotics. This whole issue is much more significant with antibiotics than these agents. So there's not a lot there. And here, alcohol-based hand sanitizers, mainstay disinfection, they're useless for, by the way. They're just not great. But in COVID, I understood it. Okay? And I could deal with it there. And if nothing else, it made us all aware how important hand washing and hand care and I'm fine. If somebody's like, we have students online, somebody said they didn't feel well, that's great. Nobody wants to make anybody else sick. So I think we're all a lot more appreciative of that. And yeah, iodine and all that. Heat. Here it comes. Last topic for today. When we chill something, all we're doing is lowering its metabolic rate. When we freeze it, we almost suspend its metabolic rate. When it comes back to temperature, it can still harm us. So it's useful for certain things, but not for destruction. Moist heat, certainly the most effective. Dry heat, the limitation is its ability to penetrate, and the fact that it's a little harder to do these things in bulk. A little harder. I mean, you can do, I had a colleague, one of my mentors used to sterilize. He had like a dry heat sterilizer, but he only could do small packages of instruments at a time. It was a limited system. So moist heat, lower temperatures and shorter exposure to sin, and that's really, and it's about time. I mean, in a pinch, if you were in an office, I mean, you could get a toaster oven and sterilize stuff if you had to. That's what I mean, because a lot of times not everybody practices in a hospital environment. It's just the way it works. Okay. And again, proteins play the role. Dry heat, you're doing it. Okay. Denatures the proteins, all of this, but basically, when you're flaming that loop, you're oxidizing, burning them to ashes, they're gone. And they're just showing you some illustrations. The numbers are interesting. The most important of these numbers is right here. You use, basically, it's a pressure cooker. The name that you will see and we will describe is the autoclave, 121 degrees Celsius, which is about 252 degrees Fahrenheit. We do it in Celsius. At 15, in a closed system, since temperature, pressure, and volume, there's all a relationship that's there. It will reach in that closed system, like a pressure cooker, 15 pounds per square inch. So if you look at just the meter and it's only in PSI, you know it's 121. So the PSI is a critical piece. For 15 to 20 minutes, in my office, we did it for 30 minutes. We didn't have to worry about the time. We only do a few, maybe do a run every day or two. Don't have to worry about that. Plenty of time. Hospitals don't have that luxury. So they'll find the time that works for them. But they have enormous units that are there. Sometimes an instrument will fall out of the field but not really be contaminated. For instance, if you're in an operating room and you're circulating there, or even if you're scrubbed in. So let's say understand the field is from the width of your shoulders to your waist and your shoulders. If you do this, that's now contaminated. Not sterile. Back away, go back and re-sterilize, re-gown, and re-go. Here. Instinctively, it's falls. You go, oh, no bueno. You've now contaminated. You're done. You have to go back and start all over again. There's no 5 second. So what happens if it does fall out of the field, and the person's here, and you're at this area, and it's down by their legs? Someone will take it, and they can do what's called flash. You don't have to know this. But flash sterilization, they have a unit in most large, like a large hospital, Presby or something like that, HEH, where they can flash that at about 134, 135 degrees, 3 minutes. They don't, as long as it's not significantly contaminated, just fell out of the field, and get it back to you. There's a lot, and sometimes they're very specific instruments, hemostats. There's so many of those you don't have to worry about. They have packs and packs. But that sometimes is utilized. It's useful knowledge. It's the kind of stuff that if you're working OR, to be familiar with. All of that. Dry heat, typically an oven. Most textbooks will tell you 400-degree oven for about 90 minutes to 2 hours. And so endospores, etc. And this brings us to I think this is the last topic for the day, and I'll get back. Yeah. Oh, good. Pasteurization. I'm going to cover it in detail, but these are the numbers. And Pasteur did that, the famous stuff with the wine, and they're still doing it for fine wine in France. To be sure, it's called the batch method, because time is not as important as doing it traditionally. It's about 62.5 degrees Celsius. That's about 140 degrees Fahrenheit for 30 minutes. That works if you're in an elite industry and doing it as they've done it forever. It doesn't work. And when you buy something pasteurized, when this was pasteurized, whatever food product you're buying or using, when that went through pasteurization, most likely they did what's called HTST, high temp, short time. They bumped the temperature up to about 72 degrees Celsius, 15 to 20 seconds. Yeah. In the food industry, in any industry, time is money. So it works just as well. It's just much more efficient. So, and most of the consumables use this method for commercial sterilization. For commercial, I beg your pardon, pasteurization. If they're fatty foods, ice cream, heavy cream, that type of stuff. There's ones with all the milk fat that's in them, yummy delicious. 82 degrees Celsius. Again, for maybe the same amount, maybe 15 to 30 seconds, ballpark. That's the way, because fats can, you have to take a little extra time, a little extra heat rather to get that. You're going to see a lot of things that are ultra pasteurized, and they are shelf stable. They don't require refrigeration. That is not the same. Ultra pasteurized is really an alternative kind of sterilization. So when we had our convocation, our all-day faculty meeting, the food place, in those little packets you open up that have half and half in them, those neat little creamers, the different flavors, those are all ultra pasteurized. Juice boxes. Basically, they sterilize the interior of the box with what's called vapor phase peroxide, superheated peroxide. We're going to see it again when we do chemicals. And then there's a special way, and it's typically with dairy products, so it can be with any consumable. And they have that, they superheated, and we're talking about something about 140 degrees Celsius for 2 to 5 seconds, let's say arbitrarily. And then boom, they shoot it into this special container and seal it right away. That's what ultra pasteurization is. It is not the same as regular pasteurization. It is much more like a form of sterilization. I know it surprises people, but when you and I buy dairy, when we go to Giant Eagle, where do we get our dairy? We go in the refrigerated thing, grab milk, grab half and half, grab, whatever, yogurt, right? Nearly all dairy products, okay, in Europe are and you can buy these products in a lot of stores around here on the shelf in basically a modified juice box. They do not have giant refrigerators. The refrigerator may be a little bit bigger than your dorm refrigerator, if you have one in your dorm. Once it's opened up, it goes in there until the next one has to be opened up. They're not in love with refrigeration. Okay, it's a different culture. We go once a week or however often to buy groceries and just pick things out. They go to the markets daily, every other day. It's all about fresh, quick, whatever you want to call farm to table. They'll make whatever there. It's a different culture. And space is a significant issue. So I mean, you have to be aware of cultural differences. Most of us, if you're fortunate enough, have the big refrigerator with the double doors and all that. Love that. You have to dig in there. Is it in the refrigerator? I don't know. Give me about 10 minutes. I'll see if I can find it. I'll leave you on that comedic note. Goodbye. Have a wonderful day. God, but on Wednesday, would somebody please laugh?